Senator Mitt Romney tonight, blasting the federal effort, or lack of effort in his view, to roll out the COVID vaccine quickly.
Romney says right now there isn't a plan, so he's offering some ideas of his own.
Fox 13's Brian Schnee joins us live from Utah's Capitol Hill with more. Brian.
No plan at the federal level, but state by state, there are plans to get vaccines out. Senator Mitt Romney telling me today that he believes the vaccination process could be much better organized and executed to get more vaccines out sooner than later, and it starts at the federal level.
The vaccine has been manufactured. It's being shipped out, but it's not getting into the arms of the people who want it and who need it.
Praising the quick actions of developing the COVID-19 vaccine, Utah Senator Mitt Romney saying it's the COVID-19 vaccination process that is falling behind.
The federal government thought their job was just sending out the, super frozen vials. That's great, but that's just a start. You have to find a way then to have the number of people necessary to actually carry out the vaccinations.
The senator outlining some ideas for consideration, such as learning from past vaccination programs and enlisting retired or active medical personnel who aren't caregivers to assist with administering vaccines, and opening more vaccine sites in places such as schools with medical staff to monitor for reactions. Romney also saying that billions of dollars have been allocated for states to hire more people to administer vaccinations, but says the federal government hasn't instructed states on how to do so.
This needs to be organized like any major event or any major undertaking, and so far that hasn't happened.
In a statement to Fox 13, the Utah Department of Health agreeing with Senator Romney's assessment, saying the initial rollout is slower than what we would have liked. However, we have made significant strides this week as larger distribution channels, like local health departments and pharmacy chains that are vaccinating in long-term care facilities, have opened up.
This shouldn't be seen as the kind of urgent crisis where if people are not vaccinated this week, they're likely to die. That's a huge exaggeration, and it's appropriate.
U of U infectious disease expert Dr. Jay Jacobson says there are still a lot of public health questions that need to be answered about the vaccine. Responding to Romney's comments, he believes we're ahead in terms of the initial timetable that was given for vaccination development, but behind in the process based on some of the initial goals.
Ahead or behind is a relative judgment, and in this case, the goal was a mistake.
I believe that it's pretty clear that the vaccination program is not going as planned. There were supposed to be 20 million vaccinations by now across the country. We're at about 3.
Nonetheless, in our conversation earlier today, Romney praised the efforts in the state of Utah for the vaccination process here in the Beehive State, but said it's only going to get harder as it becomes time to vaccinate part of the general public. Right now, Utah is vaccinating a little bit more than 3,000 people per day, not counting over the holidays. Governor-elect Spencer Cox saying today that there was a span over the last 2 days at one point in a 24-hour span where they were actually able to vaccinate more than 9,000 Utahns. Live on Utah's Capitol Hill tonight, Brian Schnee, Fox 13 News, Utah.
Brian, thank you. And Senator Romney, not alone. Many other health professionals around the country are voicing concerns about administration of the COVID-19 vaccine. Officials originally projected 20 million would have had a vaccine dose number 1 by now, but in reality, under 2.8 million people have reportedly gotten it.
Many parts of rural Georgia, both in the north and the south, there's vaccine available and literally sitting in freezers. That's unacceptable. We have lives to save.
Medical professionals are calling for more local resources and funding to help push vaccine administration forward, as the CDC predicts more than 80,000 Americans could die of COVID-19 in the next 3 weeks.